This instruction video will serve as a guide to help the staff understand patient flow during the transition to the new emergency department. Waiting room tech responsibilities. The goal of our department is to initiate patient care and treatment, even in instances when a physical treatment space may not be available in the main ED. The waiting room tech is responsible for performing the 4 following duties in this order: transport, EKGs, lab draws, and hourly vital sign reassessments. When a patient arrives, they should be immediately greeted by the nurse first, and the nurse first will obtain the patient's name, date of birth, and chief complaint. If there are no patients to transport, the waiting room tech should perform EKGs. Our goal is to perform an EKG within 10 minutes of arrival for all patients with chest pain. When there are no patients to be transported and no EKGs to perform, the waiting room tech should then prioritize lab draws of the patients waiting in the waiting room. The lab draws should take place in the lab waiting area. Hourly vital sign reassessments are the last essential duty of the waiting room tech. This includes blood pressure, heart rate, and respiratory rate. Repeating the temperature is important, particularly if the patient is febrile. And finally, capture an O2 sat with the pulse oximeter. And don't forget to document your vital signs.